Everyone.
Good morning.
Good morning.
Good morning. Good morning. If everyone could type in the chat your name and your agency, that would be great. We would appreciate it. And we'll get started here in just a few minutes to let everybody come in. Looks like we got a lot of people here. Great. Wow. Okay. 2 people. Etta. Okay. Susan, are you able to let people in?
I am.
Okay. We're both like tag teaming, I think, getting people in here.
3 ways. I'm going too.
Are you doing it too, Taryn?
Yeah.
Okay. Okay. Good. We will wait until 10:05 and we will get started. Thank you, everyone. If you're just logging in, if you can type in your name and your agency in the chat, that would be great. We'd really appreciate it. Okay. 1 more minute. Sounds like everybody is in. And everybody should be able to see my screen. During the presentation, if people want to ask questions, feel free to ask. You can just verbally ask a question or type it into chat. And Taryn will help facilitate those questions and ask those. Susan and I will be doing the presentation. And it is 10:05, so we'll get started. Excuse me. Goodness, I should drink more water this morning. So welcome everyone. This is the pre-proposal meeting for our 2026, what we're referring to as fee for service application. So all of you that are on this meeting should have an existing contract with us. And if you don't, please put that in the chat and let us know because we'll need to meet with you separately. But this application is for everyone. Gosh, I need some water. For everyone that is currently has a contract with us. As you all are aware by now, we have a new grants management system called hold on a second, called the Partnership Exchange Portal. Meaning we're going to exchange information with you, exchange money, contracts, all of that kind of stuff. So that's why we named it the Partnership Exchange Portal, PEP for short, because we're peppy about giving money. Isn't that funny? Anyway, here we go. Oh gosh, what's going on? Oh, thank you. Okay, now for some reason, my presentation is not advancing. Okay, here we go. Now it is. All right. So the agenda, what we're going to go over is we're going to review the timeline for the 2026 contracts. What you're going to see as far as review of the portal is very high level. Oh, excuse me. It's very high level. So this is really going to be a learn by doing exercise. For all of us, we are new to this system as well. Therefore, we're not going live to take you live into the system. We hope that you're going to get real comfortable with being able to go in and navigate PEP. It should be pretty self-explanatory. There's probably going to be some nuances, but we will work through those with you. Susan's going to review all of the application questions. A lot of them are very familiar to what we've asked in the past, and address any concerns or anything that you have. I want to assure everybody to try not to have too much anxiety about this new system. In the end, everyone's going to get their contracts and your awards, and we're going to work through this together. So we appreciate your grace. Timeline for the 2026 contracts. Everybody will be moving to a calendar year. So this is going to be for all of the safety net, all the children and families, domestic violence and sexual violence, all of the special populations. Some of you are in 12-month contracts right now. Others are in 9-month contracts. So everyone will be going to a calendar year contract starting January 1 to December 31st. The applications are due by October 10th at 5 o'clock. The board will be voting on all of the grants on November 20th at the board meeting. After that board meeting, we will be working on issuing the contracts. The contracts will come from the PEP system. So everything from here on out will be housed in the PEP system. Your first payment for your 2026 contract, you can expect around the February timeframe after all of the reconciliation is done for the 2025 billing. So the existing portal that you all use now for billing, you will continue to use that for your 2025 billing. And then in 2026, we will be moving everything into the PEP system. And feel free, if anybody has any questions, feel free to ask. Okay, if you haven't already gotten into the system, you can access the PEP through the website. Go to the existing agencies section of our website. You see it circled there, and you'll see the fee for service definition, that announcement for the fee for service grant. Again, everybody is filling out the exact same application. So if you log in there on the button, then you will come up and get to the first page of the PEP portal. And from this page, everyone should either have an existing login because you've already been in to do your organizational profile. If you haven't, then you will create a new login and you will go to that login here on the right-hand side. So here's the login. I've highlighted that. Let me explain a little bit about the difference with the organizational profile and the agency information once you get into the system. So the idea around this portal is that any agency that wants to apply for funding for us will first create an organizational profile. Those of you who are in our network and have longstanding contracts with us, from here on out, once you apply for any type of funding that we may have available to you, your organizational profile information will automatically populate the agency and contact information in the actual application. So you don't have to always fill that information out. You can throughout the year update documents and stuff like that, or update contact information. But the intent is once you're approved as an organization, you've created your organizational profile, all of that information is stored in the system and then will be helped to pre-populate other parts of the application. So this is the very first step. Everyone needs to have an organizational profile. There's been some questions about agency roles. So the agency grant staff and the executive director can create and submit the application. And the agency grant staff, ED, agency fiscal person, and clinical or program staff person can fill out and edit the application and your service plan forms. The service plan is synonymous with the past expenditure plan, and Susan's going to talk about that in more detail. So again, work with your grant staff. If you don't have a grant staff person and it's a program person or whatever, that's fine. One person can serve in multiple roles, but one individual needs to be the one to go in and create your organizational profile and then populate all of the agency contact information. It's important to fill out everything, even if one person is serving multiple roles, because as we send out communication, for instance, we may need to send out communication to all of the fiscal people that a payment is coming up. We're going to be using the PEP system to do that kind of communication. So the portal will serve as our database to communicate with all of the appropriate people within your organization. Okay, so once you create your profile, those of you who have already have a profile, you should be able to log in now and see the fee-for-service application. So it went live this morning. So on your dashboard, everybody will have a dashboard, and you will see My Opportunities. And under My Opportunities will be the fee-for-service application. Your dashboard serves as the hub of all of the information. When we release other opportunities for grant funding, that will show up under My Opportunities. If there's announcements about particular things, will show up as under announcements. Once you start an application, it will move from My Opportunities to My Tasks, and you will continue to work on it under My Tasks. And also any communication to and from the Community Mental Health Fund staff will be done through the portal. So look for that. So that's one way you can find the application is on your dashboard under My Opportunities. Another way you can find the application is on the very top. I don't know what this is called. I can't remember. This first little button here on the ribbon, the top ribbon, you can find a search button. And when you click on the search button here, it will have application and grants. And when you click on application and grants, it will show all of the grants that are available to you as well. Again, right now, the only one that's available is the fee for service. You can also find any kind of progress reports, financial reports, the site review reports, etc. will next year will also be housed in here, so everyone will have access to those. So again, two ways to find your application, either on your dashboard under My Opportunities, or you can do a search.
Quick question, Teresa.
Yep.
Farrell is asking, will they still get an email and notifications from us in addition to accessing information in the portal?
Emails referring to,
I believe, does that mean
like, just general emails?
Or does it mean Farrell, things we put in the database will be populated automatically in an email notification? If you wanted to expand upon that, Farrell.
Can you go off of mute and go ahead and ask the question? I'll tell you, our intent is to use the portal for back and forth communication as much as possible. We are required to do RFPs as a public notice. So the portal is more internal. So RFP notices will be public and will go out via email. But once you're working on an application and things associated with your contract, etc., you can expect that kind of communication to come from the portal. I hope that answers the question. Looks like it does. Okay, great. Thanks, Taryn. Again, here's just what the My Opportunities looks like. It'll say fee for service application for 2026. The availability, that means this will be all updated. This is just a test portion, but it will show you the contract period and when the application is due. So once you have clicked on the fee for service application, you will get to the actual landing page. This menu that you see on your left is where everything associated with the application and communication will be. Get comfortable with navigating this. You can click on things, see what's all in there, all of that kind of thing. But this is your landing page. This is your navigation menu. All of the forms associated with the application are here. Again, you'll see the fee for service application at the very top, forms, application forms. So this is the meat and potatoes of the application for 2026. You will see the agency information, the contact information, the service area. I'll go over these three areas. Susan's going to go over the project description. This is the application questions and the service plan, which was the expenditure plan, and a place for attachments. You don't really have to do much with that. That's just a placeholder. So this, again, as you can see, this is the menu. This is the navigation menu for everything associated with the application.
Teresa, Jim's asking, can they print a copy of the application as one document?
Yes, yep. And we'll touch base on that here in just a minute. Okay, so under agency information, this is the first part. Again, it's your general information. A lot of this should be populated from your organizational registration that you already did. In the registration, it also asked you for your agency documentation. So that's your 501c3 letter, your board roster, certificate of good standing, your most recent audit report, your liability insurance certificate, and if you are accredited, your accreditation certificate or letter or whatever the case may be. I know this seems like a lot of stuff for this time, but remember, once you have it in here, it will stay in there and we won't be asking for it again. And if anything changes throughout the year, then you can just go in and update it whenever you'd like. I know a lot of you send us your insurance liability certificates, and we really do appreciate that. But now you can just go into the portal and update it and send a message, hey, I've updated this, but we should get a lot of those kinds of notifications. So after this year, this initial population of everything will be carried over from year to year and updated as needed. The contact information, again, this should also have been populated from your organizational registration. So put in your executive director, because that will be the one that signs off on the application. The project director, that is can be your clinical director, director of operations, anybody that's associated and needs information for this contract. The main point of contact, synonymous with your grants administration or administrator. If you don't have a grants administrator and it's the project director, those two are the same person. Just populate the same person in both of those roles. And whoever is taking care of the finances, bookkeeper, accountant, the fiscal contact, so that if there's any billing issues or anything like that, we can have communication with that person as well. Service area. So if you've been with us for a long time, the zip code information that we collected in the end of year report, we're going to collect it at the front end. Hopefully this will make it a lot easier for you. So what we're looking for here is, what are the zip codes that most of your participants are coming from? Or what are the zip codes that you are primarily focused on serving? Some of you may serve the whole county, and if you are, then select all. And some of you may have try to be more focused, say either in Eastern Jackson County or Southern Jackson County, whatever the case may be. So if you could select what zip codes you feel like you're primarily focused on, that would be great. So you can select all again, or you could just go through and select whatever zip code is most appropriate. Oh goodness, how did that happen?
Farrell had another question real quick.
Okay.
Can they include 2 individuals as financial contacts?
Yes. Yep. Yep. One person can serve in multiple roles. Yeah, you should be able to. If there's a problem with that, then just send us a message and we can figure it out. Okay. All right, then at this time, I'm going to turn it over to Susan and she's going to go through the actual application questions.
All right, thank you, Teresa. Good morning again, everyone. We're going to start with the project description, which is primarily the narrative portion, all of the questions. And this section applies to the programs and services that you are requesting funding for. You will click in the navigation menu, click on each heading. It will display the questions for each section. And there's a next button, so you complete the question and it's automatically going to take you to the next one. As Teresa mentioned, these questions should be familiar to you. They're not new, so either through the site review process or prior applications, it's something that you are familiar with. So to move through the questions, first state your organization's mission and briefly describe the services. You'll itemize services in your service plan, the former expenditure plan, so there's no need to list services here. Again, summarize services that you're proposing with these funds. Next, we'd like to know what memorandums of understanding you have with other organizations to address the social determinant needs of your service participants. So we're looking at what formal arrangements or agreements that you have to address such needs, social determinants such as housing, physical health, employment, food insecurity. You may address those within your own organization, but if you have agreements with other agencies, we would like to know who those are and for what social determinant. Next, if you are participating in the value-based pay program, we want you to list up to 4 goals that you currently have in place. You can have some latitude on summarizing those goals. Some of them, it might be a little bit lengthy, so you can summarize it. However, when entering the principal key performance indicators that correspond with each of those goals that you're listing, please use the KPI definition, not the short name. The short name may not convey understanding. It makes sense to you and is short for that reason, but for the readers, our board who are reviewing the proposals, we want to make sure they have a good understanding of what that indicator is.
Susan, real quick.
Yep.
Even if you're not in the value-based payment program, there's just a few of you who are not doing that. In the prior applications, you still listed what your goals and outcomes were. So if you could still write something, there does not have to be 4. So if you even just have 1 goal and one outcome for your program, still put that in there. This is the place where you would put that kind of information. Those of you in VBP, this should look very familiar to you as far as how to write your goal and KPI statement that's currently in your workbooks.
Thank you, Teresa.
Uh-huh.
Good clarification. And then finally, related to goals and outcomes, provide an explanation, 2 specific examples of how data has been used to inform and improve your programs or services. So reference the data that you're collecting in your explanation, and then provide example description of how you actually use that data to inform your programs and services. Next slide.
Hold on a
So now
second.
we're-
My computer is like a little
That's
delayed.
not what it's supposed to say.
For some reason, I am getting this delay. I don't know why. Maybe it's time for me to get a new computer.
Does it make a difference if your video's off?
Can you right click the slide, Teresa? Next slide, advance, just on the PowerPoint itself, maybe.
Okay,
There we go.
there it goes. It may start to advance a bunch from hitting the button, so I'll fix it.
So now we're going to go through the project overview. Again, previous questions, click next, and it gets you to the next place. These questions are familiar to you for the most part. We would like to know initially what your agency's overall mental health practice model or approach to service is. What we're looking at is a broad umbrella philosophy or framework that guides your practice. Next, we'd like to understand the process of how you assess and measure fidelity to that model or approach. For example, if you operate under the tenets of trauma-informed care in your own quality practices, how do you assure, what indicators do you look at in terms of maintaining the philosophy of trauma-based care? Next, provide the date of your last quality assurance and improvement review, and described how the information was used to improve or inform programs for services. What we're talking about here is your internal agency process for quality improvement and insurance overall. Next, similarly, provide the date of your last agency client satisfaction or feedback survey, and how information gained from that, again, was used to inform or improve services. For both questions, QA report and client satisfaction or feedback survey, if there's no date, just state that and then provide an explanation in the comment section.
Susan, if for these two sections, these two questions, there is a place where you can actually put the date. It does not allow you to put a future date. So if for whatever reason there's no date, or maybe it's in the future, then you can hit NA and then provide an explanation.
Thank you.
Mm-hmm.
Next, enter the number of new participants enrolled in the past year who received services funded by the Community Mental Health Fund. This can be contract year. We're looking at a full year. So the most recent contract year ending would be 2024, or your most recent completed fiscal year. Again, number of new participants enrolled receiving services funded by us. Next, explain
Oh, so
efforts.
real quick, Heather had a
Yep.
question in the chat
Yep.
box.
Oh, Taryn, can you tell us the question, please?
Oh, yes. Please expand on quality assurance / improvement review. Is this referring to audits / reviews conducted by CMHE? CMHE?
Very good question. For clarification, no, this is not the site reviews conducted by your program liaison with the fund. It is not referencing other funder or body, like an accreditation body review of program or recertification. This is talking about your own internal quality assurance and improvement practices. So that might be related to internal chart reviews, for example, that you conduct as a means of assuring practices are in place as intended, and that just your quality improvement practices overall. So that's internal to the organization. If you do not have a formal process for providing quality assurance and improvement procedures, you can just indicate that. Next, describe efforts to maintain client engagement or provide support while waiting for service. So this might be in relation to, say, managing a wait list if kept, offering interim service such as groups while waiting for service, and oversight for the engagement of existing service participants, for example, response to no-shows. What type of follow-up or outreach is done in order to keep that client engaged? And then lastly, on this section, you will have a drop down to select from for various diagnoses. And so you're just going to select the 4 most common primary diagnoses among participants that are currently receiving services. So that's just a drop down that you select from.
And Brandy's asking, is diagnosis a mandatory field? They don't have diagnosis in their services.
Teresa, I'm going to defer to you. Is there a comment option on this?
Yes, if you are not diagnosing, then you can hit other.
Okay.
Yeah. And I
Just hit-
believe there is a place for you to explain that. I'm pretty sure. But if you don't, then just hit other, or if you yeah, just hit other.
Okay, next slide.
Okay, why isn't this working? There we go.
It's just trying to give you grief, Teresa.
I know.
Okay, so next we are going into some questions about funding information. Pretty self-explanatory. Do you bill Medicaid or other insurance plans? Yes or no? If you do not, explain. Actually, let me clarify. So this is where grace is needed. Teresa, if is there an explanation required here if it is yes or no?
I think it's just for no.
Okay.
Yep.
Next, list the top 4 major non-community mental health funding sources that support your mental health services and programs, and the dollar amount.
So this could be if you have state funding, if you have other philanthropic funding, you know, Health Forward, Reach, Hall Family, any of those others. If you have a different state contract or something like that, anything else that is funding your mental health services, it only gives you room to list the top 4. If you have less than 4, then that's fine too.
Next, and we've said this, we say this every year in a pre-proposal, this is an important question. And sometimes board members go directly to this first. Explain major changes to your mental health service plan from last year's contract. And again, service plan is also known as, in the past, your expenditure plan. So we absolutely expect there to be some variance to your previous year's plan based on needs, et cetera, the organization, funding differences. But we want you to address significant changes. For example, adding a new service that you have not proposed before, or perhaps because of a change in funding, you're no longer serving or requesting funds for an existing service in your current contract. And next slide.
There you go. Challenges.
So challenges, what we'd like to hear, and again, it's a very important question the board is very interested in, focusing on Jackson County, we want to understand what changes or challenges have occurred in the last year, and we know there have been many. But we'd like to know how this has affected your particular organization and what strategies you have taken in response to that. And next slide. So now we're going to talk about the service plan. Again, this was what we used to call the expenditure plan. There really aren't any changes in how you're reporting your proposed services. They're called, the language is a little bit different. So what I want to start with is that now there are essentially 3 types of service unit payment. We have a set rate, full unit cost, formally fully funded, means the fund is paying for the entirety of that service unit cost at our rate. Partial unit, formally partially funded, where the mental health fund is paying a portion of the set rate meaning the rate that we are prescribing for a given service. And then finally, a variable rate. And this also fell under the partially funded category. The distinction there is that there is no prescribed cost or set rate from the fund, but the cost per unit remains the same, is set by the organization. And the best example, and it may very well be the only, but children's residential treatment. We have several providers that provide residential treatment. They have a set rate for that service, but the set rate is different for each of those providers based on uniqueness of their particular residential program. With that said, you will open your service plan selection form, and there you will see these 4 types of service that you need to select what you will be applying for. An adult set rate, full unit, adult partial and variable units, and then the same for the children's services. Children set rate, full unit, children partial and variable unit. You may have one of those that fit your proposed service array, or you may have all. It's important to click all of those so that the proper form will come up for you to populate.
And Rochelle's
Perfect.
asking, will bed nights fall into partial and variable? Susan?
So I'm gonna, bed nights, I believe would be, no, I think we have a set cost for bed nights. So in that regard, it would be a full rate. If we do not prescribe that, and I apologize for knowing off the cuff, if that is a set rate, then it would fall into partial. It would not be variable. She says with some confusion in her face, because the best, we're navigating this too, the language being different and how we're doing it. So at the end of the day, just make sure that if you have a question, not literally the end of today, but if you have a question about how to calculate your services, whether it is qualifies as a full unit, partial, or variable, get in touch with your respective program liaison, and we will help walk you through that.
And Farrell asked, will there be any changes to the set unit rates this grant cycle as there were in the current?
No, all the set rates for full unit cost remain the same as last year. So you will select the appropriate services, and then once you do that, when you click next, it's going to take you to the ones that you have selected to complete. So next slide.
Okay, here you go.
So for the service plan, the set full rate, you are going to select the service from the drop-down. Only services that qualify for that full rate are going to be populated in the drop-down. So select the service, enter the number of proposed service units, and save. The set rate prescribed by the fund and the total for that service line item will be calculated for you. You will see that come up.
And for those of you who have a long list of services that you provide, there's a little plus button here at the end. You just hit that plus button and it'll give you a new row by which you select the next service unit, populate all of that, hit save, and it will continue to populate the set cost and the total.
Thank you, Teresa.
Uh-huh.
Next slide.
Oh, darn it, I got ahead of myself. Hold on. There we go. Here's the partial.
Okay, thank you. So this is for the partial and variable unit rates. Again, select the service from the drop-down. Enter your proposed number of units and the proposed number served. The current full set unit cost for that service will populate. Hold on. And then the average partial unit cost will be calculated for you, and that's based on a total dollar amount entered divided by the number of units. It's the same calculation that you've been using for partially funded. You have a total dollar amount for what you anticipate spending for that partially funded unit, the number of units, and then doing the math, and the system will calculate what an average unit will be. The variable cost follows the same steps, although it does not ask for the number served. So select the service, enter the proposed number of units and the total proposed dollar amount, and save.
Yeah, they all ask for the number served, Susan.
Oh, they do?
Yeah.
I missed that.
Yeah.
Okay, I
Yeah,
apologize.
they do.
Okay. Number of proposed units, number proposed served, and the total dollar amount.
And regarding variable, there are only a few services that have a variable rate. Those of you who are really familiar with the service plan, it's mostly the children residential units, and I think behavioral intervention may be one as well. So when you click on the variable rate service, there is only a limited services that are eligible for that. So you will not have access to everything.
And again, so if you are trying to select something and you don't see it, please consult with your respective program liaison and we will help guide you through that. Next slide.
Okay, here's the summary.
Okay. It's the delay is just letting the information download. So it's a good thing.
Thank you, Susan.
So for your service plan summary, this will list service by service, the total for the particular line item of an individual service, and then a total dollar amount grant request that you are asking for. So we used it in the prior portal. You would enter amount requested, and then you would get a flag if your service plan, your expenditure plan didn't equal the amount requested. So just make sure that you are looking at the total on that service plan. And if it's not the number you are anticipating, obviously that's a hint to go back and review. If for whatever reason an edit needs to be made, it can be after, if those edits need to be made after board approval, we can open up that section for amendment if that is needed.
Yep.
Next slide. Attachments. Again, that's on your navigation menu. This is not required. And all of your required documents are in the organization profile that you completed and Teresa talked about earlier when you initially signed up and registered. Additional documents are optional, such as maybe an annual report, but again, not required. Don't give yourself more work if it is not necessary. So we want to be clear, however, that all of the questions, answer all of the questions that are in the actual application form completely. Do not refer to an attachment as an answer to the question. For example, we're asking about when the last quality assurance review occurred and how that was applied. Provide the answer on the application itself. Don't refer to an attached QA report from your last review. Upon review, if we do need additional documentation or documents, in this section is where you will actually upload it. I'm seeing a couple of questions here. No, we are not asking for pie charts. And the recording will be available. Taryn, you answered that. Thank you.
No problem.
Okay. So yes, some of the attached forms from the previous application, if you don't see it specifically, you do not have to attach or upload that. So we've taken out a number of those forms to be uploaded, which is a good
Now,
thing.
that's not to say they won't be asked for in future years. What we did this year was we gave the board all of the previous questions that we had asked and what is also asked in the site review, and asked them to put together what are the most important questions and items that they want to see in order to make funding decisions. So this is the result. The board this year, this is the first time that they will also use this system by which to review the applications. So they will be going through their own review process, and from that review process with them, we will gain a lot of information as far as how they're feeling about these questions. Is there additional information they'd like for us to collect in the future? And things like that. So for right now, this is what they've asked for, and we're going with it.
Okay, next slide.
Okay.
Printing and downloading per Jim's question earlier. Yes, you can print all or a part of your document. From the navigation menu, you're going to select Document, Validation, and Submit to review your forms. If a form, you're going to if a form shows in the document validation, if a form shows an error or that it's incomplete, you'll be able to click on the title of that form and it will take you back so that you can make corrections. And when you are ready and you feel the application is ready to go, you will just simply hit select submit. And then once submitted, no changes can be made, but if needed, we can reopen the application to amend. I think I skipped ahead.
Yeah, that's okay. So on the left-hand side here, you will see the document validation screen.
there it
So
is.
yeah, when you click on that screen, if you do have any errors, you'll be able to see exactly where the errors might be. And it can be an error because the question, maybe something wasn't checked box, like maybe you forgot to put a date or NA, or you didn't answer the question, so you can go back. And if you don't answer a question because you're waiting on somebody else to give you the information, that's okay too. Let this document validation tool help you continue to work on the application and such. And when you're ready, either on the October 10th or prior to that, you will see on the navigation menu where it hits submit. So that is where you submit the application. I'm going to go back real quick to the print screen. So here you have a lot of options on whether you print or download. You could just print off a page and send it to somebody, download a page. So use this print portal to navigate what you want to print, how you want to print it, how you want to save it. So there are a lot of functions there.
And Farrell's asking, is there a downloadable template that they can work on offline before uploading and submitting the full application?
You should be able to, once you go into your fee-for-service application. If you want, I haven't tried to do that yet, but just go straight to print document and see if you can just print it all blank. You should be able to. Okay. Any other questions regarding that? Okay.
I'm gonna hand back to Teresa.
Okay.
Thank you for the
Uh-huh.
grace in still learning the system ourselves.
Okay, so some frequently asked questions. What agency audit should you upload? The one that is the most recent audit that you have. For most of you, it's likely to be 2023 and 2024. So just stick those in there. And again, as you do them, you'll just upload those into the portal. Can we print? Yes, you can print and download. Use the print function in your navigation menu and get familiar with all of the options for printing. Who should the main contact be if there isn't a grant administrator or grant staff? Whoever is the main person for the coordination of your application. If it's the program person, that's fine. If it's the executive director, that's fine. More than one person can serve in a role. Will you have a chance to correct anything? You can edit anything that you want before you submit it. Once it's submitted, you will not be able to open it back up and edit anything. So just make sure you're thorough and do all of that. Once the board reviews, if there are any additional questions or information that they have, your program liaison will communicate with you in regards to that via the portal. So I don't anticipate anything major, but you all have been with us for a long time. You know, sometimes the board may have additional questions, etc. It won't impact your dollars. It's just they're getting familiar with the new system, the new set of questions, etc. And so you can anticipate anything like that coming via the portal. We'll open it back up, get all of that information, and go from there. How long do you have to submit any additional questions after this presentation? You have until the September 17th, and I'm going to show you where all of those questions will be answered. Taryn, are there other questions? I see a couple popped up.
Oh,
Maybe.
yes, I had to scroll down. Christine, can you please confirm the last day to ask questions? The public notice says September 2nd, September 18th at 5 p.m. The
Does
last
the
day.
RFP says September 18th? Is that what she's saying?
Public notice.
If the public notice says the 18th, then it's the 18th.
And Tahani's asking, since communication will take place primarily in the PEP, will agencies receive prompts when there is a new communication, or do they need to schedule to periodically check? For example, when the contract becomes available, do they just need to check now and again throughout December, or will there be a notice that is available?
We'll send out an email, but I believe the system will automatically notify you when there's stuff. That's why it's so important to have that contact information in there, because we can send out announcements and we can check off who all we want to get that announcement. So it will automatically send you an email. Okay, anything else?
And Jennifer's asking, how long does it take for a new PEP account to be approved after created? Jennifer, it'll be approximately no more than 3 business days. I'll get notified and we'll go in and just approve and verify that the organizational profile data looks correct. Yes, ma'am.
Yeah, and in most instances, it's a lot quicker than that.
Yes.
Okay, keep asking questions if you have them. Next slide. Okay, so in the portal on the top menu bar, you will see this little book. That's where all the training materials will be. So this PowerPoint presentation, the presentation from the IGX staff who went over the overall navigation of the portal will be located in there. This slide deck will be located in there as we, as the staff here, create new training materials or anything like that. You can find all of that in this little book icon, and it's for training materials. If you have any questions after today, please send those to administration@jacksoncountycares.org. That is Taryn's email, and she will get those questions out to all of us to answer, and we will put those in the training materials as well.
And Teresa, Farrell's asking how many people can be set up to be included in the notification emails? They'd like it to be 3 or more if possible.
There'll be, I think there's at least 4. The ED, when you create your organizational profile, there is space for at least 4 roles. Goodness. Okay. Timeline, we will put this presentation in the training materials. It looks like by the 18th, not the 17th. That's my bad. And the applications again are due by October 10th at 5:00 p.m. or sooner. Once your proposal is approved, the contracts will be signed electronically via the PEP in December of 2025. Reminder that all of your quarterly billings are still due 30 days after the end of the quarter. You will continue to use the old billing system for the 2025 billings. We'll send your first payment in February of 2026 after we reconcile your final quarter for 2025.
And Farrell just asked Teresa, will all of the individuals and all of the roles be getting email notifications?
They can. The emails that go out, we designate who that information should be sent to. Most likely it will be everybody, because we understand that you all have very different roles, and it's just important to communicate with as many people as possible. Is there another question, Taryn?
Not that I'm seeing.
Okay, great. Okay, that's it, folks. Again, try not to stress. I know having a new system, I don't know how many systems you all are working in with all of the funders having different systems, but we're hoping this is easy. It's a learn by doing exercise for all of us. Get in there, navigate. You can't mess anything up. You may find something that's quirky because we haven't been in there a lot yet either. We've just been testing it and have tried to find as many issues as we possibly can. But it is now live, and there may be some hiccups, and we will work through those with you together. We're real excited to finally have a system that's more up to date. It will be all inclusive of everything that we need a portal to do, and hopefully be easier for you all to navigate and find things and communicate as well. Looks like maybe another question. Oh no, some thank yous. All right. Well, we thank you all for participating today. Again, we'll put all of this stuff under training materials. Have fun. We appreciate your feedback, and also we appreciate your grace as we all work through this new system. So that's all, folks. Thank you. We will end the presentation now.